These services must honor the dignity, rights, and strengths of Black older adults and their communities. This requires a targeted approach, increasing resources and fostering intersectoral collaboration with organizations that serve Black populations at local, provincial, and national levels. Additionally, service providers must receive training on the unique challenges faced by this population, ensuring care is equitable and sensitive to their cultural and social contexts. Building collaborative partnerships between healthcare systems, community organizations, and Black communities is essential to foster trust, enhance service delivery, and promote well-being. So that is an excerpt from a study by Alicia Boatswain-Kyte, a professor of social work here at McGill University, where she investigated the uneven delivery of healthcare services to Black older adults during the COVID-19 pandemic. So this is the Delve Podcast, brought to you by McGill University, where we want to change how you think about management. And Alicia is my interview guest today, and I wanted to start with that excerpt because I think it summarizes well the main themes of our conversation. So I walked into this interview wondering about how to build anti-racist organizations, but I left wondering how we can better meet those communities where they are and scale up the things that they're already doing to address the gaps left by our institutions. So in this conversation, we talk about the Black experience when interfacing with public organizations, why public institutions can be so reluctant to change, and the difference between organizing through community and organizing through capitalism. So if you like this content, don't forget to subscribe to your favorite podcast player. And with that, here's my conversation with Professor Alicia Boatswain-Kyte. Let's delve into it. All right, Professor Alicia Boatswain-Kyte, thank you so much for joining the Delve Podcast today.
Thank you for having me.
So I'm really grateful you're here. So I came across some of your research, just trying to expand some of the stuff that we're covering here at Delve, and just kind of looking at different kinds of institutions. And you've done so much work on how public institutions interact with racialized populations, particularly Black Canadians here in Montreal. And I think there's a lot to learn from your work. I have a lot of questions about it. And I really want to figure out just kind of how we can build better institutions that serve these populations. But maybe before we get into the weeds of all that, I just want to get to know you a little bit. So I wonder if you could just tell us a little bit about what brought you into this field? Because I think you're a social worker, now you're a professor. I wonder if you could just recount a little bit what your path was like.
Yeah, well, I started off as a McGill student at the School of Social Work, and I didn't know that I actually didn't know what a social worker really did before I started the career in social work. It was my mom who kind of said, hey, why don't you look into social work as a profession? She was a nurse, and she was like, well, social workers work Monday to Friday, weekends off. So I said, okay, why not? That sounds great. So I did my bachelor's in social work at the McGill School of Social Work. And then at the end of my time there, we have a field placement that we're supposed to do. And my field placement was for the Batchelor Youth and Family Centers. So that's where I got my first experience of working in an institution. And it was the first of many. I ended up working in lots of institutions, probably because I'm a social worker. And so you can work in hospitals and schools. And I think at the time I was I was really passionate about the work that I was doing, but I also had some questions about that work. I wanted to understand more. And that's when I went back to school and decided to first do a master's, but then a PhD to try to address some of the questions that I was struggling with within the institution.
Yeah, wow. So then, working with vulnerable populations, that's hard work. And it's, what motivates you, every day? Well, because when you're dealing with systemic issues, these aren't things that change overnight. So I'm just curious how you keep yourself going when working on these things.
Well, I think there's a different type of work that I do now from when I was doing the work in the institutions. When I was working in the institutions, I think sometimes it was really difficult to see beyond like what you were doing in the here and now. The conditions of the work make it that it's difficult to really project or focus on sometimes beyond the kind of immediacy of that work. Whereas as a researcher, I feel more removed, but sometimes that can be a little bit too removed from the work. So you end up kind of thinking about things theoretically, but not necessarily having the ability to really test or to see what that looks like in practice. And so that's why I find doing the research with community is a really great kind of way to balance some of what you're thinking about or theorizing with what's happening on the ground. But it's definitely, it's definitely hard work. And I think that it's also work that some of us don't necessarily have the luxury to not do because it concerns our communities.
So, so we're chatting today about how to build more equitable public institutions. So I wonder if we could just take a minute to just get your thoughts on what does equity mean? I think there's that habit to think about it as like a destination, as like it's something that, okay, we're equitable now, like it's done. But I don't know if that's the case. So I'm curious to get your thoughts on that.
Yeah, I think it's a really big question. And I remember coming across a book. It's called The Equity Myth. I wish I had the authors. I don't have the names.
That's
but
okay. I can put a link in the show notes later. It's we can look it up after.
Yeah, I'm probably guilty of doing the equity dance, which is kind of putting equity next to everything that I'm saying I'm doing to build equitable systems, equitable services. But I think there's a discussion to have with regards to, does equity actually exist and how? And again, is that final destination one that is actually a destination, or are we just always striving not for the final destination, but striving to be, I'm going to use the same word, as equitable as we can in the everyday, recognizing that we might not ever have a society that treats everybody as equal, but that we constantly need to be having these checks and balances to be able to do our best, while recognizing that it might not be possible because it doesn't always serve those who need equity.
Yeah. So is that where you fall on that question?
I know that there's this question coming about racial capitalism, and I think that is probably, I'm very critical of the notion of equity because, and I said this recently, as a social worker, we kind of are earning our income and our careers based on people's problems. If people didn't have problems, we wouldn't have a job, right? So how advantageous is it for us to fix everyone's problems, right? And so I kind of think about equity in the same way. How advantageous is it for those who are in power to relinquish that power, to share it amongst those who don't have, right? So equity requires giving away from some to redistribute to others. And that's not always, actually, it's not advantageous to those that have it, the power.
Yeah. So I read a couple of your papers. You've written a lot, which is great. And it's a lot of important work. And so I gravitated towards a couple of them, but something that really struck me in one of them. So it was the paper where you were looking at the experience of older adults during the COVID-19 pandemic, and just like how invisible discrimination can be, and just and not just to the general public, but just to the people experiencing it. So I wonder if you could just talk a little bit more about that.
I think it was even invisible to me because when we did the project, it's not like we had older Black adults in mind. It was really just we need to get race-based data on COVID-19. And when we got the data, we kind of saw that, hey, older adults are doing okay compared to other populations. And that was kind of surprising because when we spoke with community, they were like, maybe you're not asking the right questions. And I think that that's part of why the problem was so invisibilized. Is that even a word?
Yeah, I'll accept it. Yeah, sure.
Because of the particularities of the older English-speaking and even French-speaking Black population in Montreal, how they are, really sometimes being taken care of by the community, other older adults. So there were a lot of professionals that were telling us, professionals from the community that were saying that there's like a whole network of other older adults taking care of older adults. And so they're perhaps not as visible because they are having some of those basic needs met by just kind of community caregiving. But when you had things like the pandemic and the restrictions, well, all of a sudden that natural type of caregiving amongst the community had to be really halted. And that's when you actually could hear of some of the difficulties that this population was facing. And it's a population, I think, that what we found was not a population that's necessarily clamoring out for their rights, right? It's a population that is really kind of, generationally, I think, very religious and very much driven by their faith. And so when they were experiencing difficulties, they were, turning inwards towards their own spirituality rather than going outwards and asking for help. So it's a very resilient, self-reliant community that made it so that we weren't necessarily seeing as much as we could see. And I think it's also, a community that we, don't necessarily, that we ignore, right? I mean, everything related to, there's a lot more emphasis on youth, right? And the problems of youth and, the violence of youth. But when it comes to older adults, well, there's less visibility, right? There's less of a concern for this population.
Yeah, that's interesting. So, I mean, on the topic of like making invisible things visible, the way you conduct your research matters too. And so you use an interesting theoretical framework to kind of frame some of your work, just kind of looking at things through the lens of racial capitalism. And I just wanted to, I was just wondering if you could talk about that a bit. Like, what is racial capitalism and what does it help you see when you're conducting your work?
I would define racial capitalism as the ongoing and continuous dehumanization of Black people, and it dates back to, anti-Blackness and the fact that Black people at one point in time were not considered human, were considered objects. And so the exploitation and profitability of Black bodies is one that we can't ignore, and that still continues today, even though we've, abolished slavery. We're still exploiting and taking advantage of Black bodies in ways that look like, our unwillingness to really address the root causes of some of the problems that these communities face. So when we think about, the incarceration of our overrepresentation of Black men in the prisons, when we think about the overrepresentation of Black children and families in the child welfare system, when we look at things like, the over-signaling of Black youth and special education. So all of these things that, I guess sometimes seem as, not connected are in fact connected. And our failure to really kind of speak to those connections and to address the root causes and the links, I think kind of just allow the situation to remain as status quo. And the only person that disadvantages are these Black children and their families.
Yeah.
And so there's almost like this blindness, our refusal to act.
So it's less about, or I shouldn't say it's less about, but it's about profiting off of the exploitation of Black bodies. But it sounds also like it's saying that Black bodies aren't worth the expense to stop these systemic problems from occurring against them.
Yeah, I think it's two sides of that, so it's like it's not worth the expense, but at the same time, we've kind of convinced ourselves that we're doing, right by, doing right by these Black children and Black families, but we're actually doing right by society, right? Because we're refusing to act and we're kind of, again, individualizing the problem rather than kind of looking at how we might have contributed as a society to that problem.
Yeah, I wonder if let's say I listen to this podcast and I'm like, oh yeah, like racial capitalism and just like the limits of what institutions can do and or willingness to do. What can I do with that? Like, is there something I can do internally to like try to push or try to help like these institutions take more appropriate steps towards supporting these young people, older people, or these vulnerable communities?
I think there is always something that you can do, whether you're in the institution or outside of the institution. Maybe your marge de manœuvre, so the leeway that you have might be a little bit more restricted within the institution. But there's definitely, I think just being aware and just being conscious of some of this stuff is important. I think that there's also something to be said about working with community. So even though you're in the institution, that doesn't mean that you shouldn't know or shouldn't be aware of what's happening in community spaces within community organizations. I think that a really great way of thinking about how to better serve Black and racialized populations is for institutions to really be in partnership with community and for there to be like an equitable sharing of power. And so for institutions to be able to, share some of the decision making with community and for community to also have some of the same power and resources to adequately communicate and collaborate with institutions. I think that's really important, but that's not always really easily doable.
Yeah, that makes sense. So, I mean, I guess this comes back to something that you mentioned earlier, just about that trust building. So, I mean, in another one of your papers, like you had mentioned that racialized victims of sexual violence are less likely to report it because they fear the criminal justice system, or they fear interacting with the criminal justice system, and that's just such a massive loss of trust in this institution. So, I mean. And you hear stories like that across different public services. So I'm curious, how do we start rebuilding that trust?
Well, I think that one of the things that was really telling in that paper was that our very definition of justice and how it is achieved is disconnected from perhaps what justice meant for these racialized populations. And so the legal system was not seen as a just system. Even today, when we look at some of the proceedings that, have been made with regards to like sexual violence and, victims' rights, there's definitely like, there's definitely a disadvantage, to come out and to engage in this system because of the way it's built, because of the burden of proof having to fall on the victim. And so, I think that's a really big question that is in some ways at the heart of things like reform versus abolition. So can we actually reform the justice system, right, with all of its biases? Can we do that, or do we need to, abolish it? And I think that can be said for a lot of systems, not just the justice system, but is it just about the trust? I think it was larger than the trust. I think we tried to with this project. The idea was, if we can just improve the trust by making the justice system, so repackaging it, and we, this organization really did try to, adapt the justice system to the racialized survivors by providing translation services, by providing really personalized services, making sure that the lawyers that they had access to were trauma informed. So all of this with the idea of wanting to restore trust for these survivors of sexual violence in the justice system. But it didn't, we couldn't repackage it because I think maybe it wasn't packageable, or it was just too much.
You mentioned these different notions of what justice means. I was wondering if you could talk a bit more about that difference.
Well, I think that justice within the context of the court system means that we're able to prosecute, the offender, right? Prosecute the offender, that the offender will have, and I'm not a lawyer, so this feels like super awkward.
Yeah, it's okay. No,
it's the legal terminology. But, just this idea that there is someone who has been wronged, and that the person that has done the wrongful thing will be punished, right? And so that to me is kind of like maybe the caricature of justice. It's this idea that someone can be punished for something that they did. And so that's a very, I would say,
classical criminology.
Exactly. Whereas in other communities, justice isn't always something that is given by a third party, like neutral, and I'm doing like
the air quotes.
Air quote, neutral, objective, like judge, but it's actually something that's determined in community, right? And so, I mean, there's so much with regards to restorative justice that we've heard from and know from, First Nations and Indigenous communities, and in other communities as well, that justice is not always something that's delivered by someone who is neutral and objective, but that justice can come in different forms that don't necessarily always mean court and punishment.
Right. Yeah, I guess restorative justice is this idea that it's the victim who gets to decide what justice means. Mm-hmm. So I guess examples I've heard of this is like, if someone broke into my house and stole something, that maybe I don't want that person to be in jail for 5 years, but it'd be nice to get an apology and maybe get my stuff back, but yeah, you kind of set the conditions for what reconciliation looks like. Or am I getting that correct? Or I'm curious to hear more about that.
Yeah, I mean, I would say that, and I think it kind of goes back to this, when we want to allow those who are directly concerned by the problem to decide, it kind of, it kind of makes it messier, I think. I think that's what government kind of thinks. It's like, well, now, this is what we've been doing. This is what we have done. This is what we do. And so the idea of tailoring to what community wants, what community needs, those who are directly concerned, giving them a say, I think maybe it makes government and institutions really, struggle because I would say that capitalism is something that is, extremely perhaps linear, right? It doesn't, it's no longer profitable if we have to be tailoring to, or as profitable if we have to be tailoring to different communities or different people. And it also kind of suggests that the problem is not the individual, but the problem is what we've been doing as a society. And it's much more costly to change or expect society to change than individuals or communities to change, right? So
yeah, that makes me think of a podcast that we had last year where we talked to two professors about the notion of anarchy and just kind of using that as an approach to thinking about how we want to remake our institutions. And it's just that idea of really kind of seeing everyone as equal and treating everyone as equal, and that power is distributed equally, and what would that look like? And so I'm hearing a bit of that in terms of like what restorative justice could look like, is really kind of trusting that people are capable of understanding what they need, and and finding those ways.
People are definitely capable. I mean, I think that's what at least I see in the research. You can ask people what they need, and they will tell you. It's a different thing, with regards to whether we will give it to them. But people will be able and can tell you what they need. It's just sometimes it's not something that is part of the service offer.
Yeah. Well, Professor Alicia Boatswain-Kyte, thank you so much for joining us today.
Thank you for having me.
All right, and that's today's interview. Thank you so much for listening. So we referenced quite a few things in this episode, so I'm going to leave a few links in the show notes for you if you want to follow up on any of those. And I'm also going to throw in some previous Delve episodes that touch on similar topics. I highly recommend our episode on anarchy. It touches a lot of the same themes that we talked about here, so I hope you'll check it out. So thank you so much to Professor Alicia Boatswain-Kyte for joining us today. Delve is the official management thought leadership platform for the Desautels Faculty of Management at McGill University. My name is Eric Dicaire. I'm Delve's managing editor. Professor Saku Montara is Delve's editor-in-chief, and he produced all of the original music. So thank you so much for listening, and I hope you'll tune in again next time. Thanks so much.